The procedure for a stem cell transplant and use of terminating cancerous cells. By Jared Weinstein. The basic process. 1. Blood or bone marrow is drawn from your donor. 2. Stem cells are harvested from the blood or bone marrow. 3. Radiation or high-dose chemotherapy eliminates cancer cells. 4. Introduction of healthy stem cells into the blood replenishes the immune system. What is a stem cell? A stem cell is an undifferentiated cell of a multicellular organism that is capable of giving rise to indefinitely more cells of the same type, and from which certain other kinds of cell arise by differentiation. What is chemotherapy? Chemotherapy is a treatment for cancer, with anti-cancer drugs that disrupts cancer cells' ability to grow and multiply within your body. The goal of this treatment is to kill as many cancer cells as possible. The areas affected by chemotherapy. The problem with chemotherapy is that it can also affect non-cancerous cells. The normal cells that are typically affected by chemotherapy include bone marrow, hair follicles, and cells of the gastrointestinal and reproductive systems. What is radiation therapy? Radiation therapy uses high-energy X-rays or beams to kill or stop cancer cells from growing and dividing. Radiation is often given in combination with chemotherapy. What is total body irradiation? Some stem cell transplant patients receive total body irradiation treatment. Unlike radiation that targets a specific area of the body, total body irradiation treats the entire body with radiation to kill the cancer cells and suppress the immune system. Why stem cells are used after chemotherapy/radiation TBI. If your bone marrow were not replenished after very high doses of treatment, your blood counts would not recover for at least several months, or perhaps not at all. With a boost from a stem cell transplant, your blood counts should return to safe levels in 2 to 6 weeks. How are stem cells acquired? Stem cells can be acquired from blood or bone marrow. They can also be acquired from an umbilical cord, if it was preserved from the person's birth. People can also get stem cells from embryos called embryonic stem cells, however this is highly controversial. Where in the body are stem cells as an adult? Mesenchymal stem cells are taken from bone marrow and can be used to make bone, cartilage, fat, fibrous connective tissue, etc. Neural stem cells can be taken from the spinal cord and brain, and can be used for the brain. These are my sources.
Created using Powtoon.